All right, my name is Kalandra Mobley. I'm a student of South University in Nurse Practitioner Program who's doing a head to toe assessment, if that's okay with you.
Yes.
Okay, washing my hands. All right, could you tell me your name and date of birth?
Angela Sapp, July 10th, 1962.
Can you tell me what state we're in?
Florida,
And can you tell me what year it is?
2026.
Okay, patient is alert and ordered to time, place, and person. She walked in without any assistance. She looks well nourished. She's dressed appropriate for the temperature and does not appear to be in any distress. We did vitals up front. Her blood pressure was 128/74, heart rate 78, respirations 20, O2 saturation 100% on room air, temperature 98.4 Fahrenheit, done orally. Height 5'1", weight 200, BMI 37.8. Everything is within limits except for the BMI is elevated. Okay, now I'm gonna start off with inspecting your head, okay?
Okay.
And I'm palpating at the same time. Head is normal cephalic, no lesions, no masses, and hair was evenly distributed. Temporal posts are 2+ and symmetrical bilaterally. We test cranial nerve 2 up front with the Snellen chart. Her vision was 20/20 right eye, 20/15 left eye, 20/20 both eyes, which is within normal limits. I'm going to check your frontal and maxillary sinuses and let me know if you feel any discomfort, okay?
Okay.
Any discomfort?
No.
Okay. All right. Patient did not experience any discomfort while palpated the sinus and the frontal and the maxillary sinuses. We are going to inspect the eyes. Okay, conjunctiva is white, clear bilaterally. Sclera is white bilaterally with no erythema, no exudates. The lenses are clear without cloudiness bilaterally. Pupils are brown and pupils are 3 millimeter dilated. Irises are brown and round bilaterally. We're going to do a wiggle test to test your peripheral vision. Let me know when you're seeing my fingers, okay?
Okay. I see fingers. See fingers. See fingers. See fingers.
Peripheral vision is intact. Next, we're going to check your 6 fields of cardinal vision. I'm going to take this pen right here and I'm just going to move it different areas, but just follow it with your eyes and do not move your head, okay?
Okay.
Cranial nerve 3, 4, and 6 are intact. Next, we're going to check for accommodation. So, take focus on this pen right here. Now move it close to your focus. I'm going to do it one more time, okay?
Okay.
Accommodation is intact. Patient eyes converge and move inward when focusing from far to near on focus. Next, we are going to check for pupillary reflex. I got direct response from the right pupil and concentric response from the left pupil. I got direct response from the left pupil and concentric response from the right pupil, so cranial nerve 2 and 3 are intact. Now I'm going to check for the red reflex, which I would have to turn off we'll just pretend the light is off and I'm gonna look into her eye. red reflex is seen in both eyes, left, right, bilaterally. I do not have a ophthalmoscope, but if I was to look in her internal eye, the structures, a normal thing would be for the optic disc to be sharp and for there to be no hemorrhaging, no exudates. All right, I'm checking your nose. Your nose is midline. The septum is midline. The color matches the skin. The nares are symmetrical. Nasal mucosa is pink. No erythema, no discharge, no lesions. Turbinates are pink. No firm with no erythema or any edema. Checking your TMJ. Alright, open, close. Now move your jaw side to side. No, open and move your jaw side to side. Okay. Cranial nerve 5 is intact. Patient was able to move their jaw freely and without any discomfort. There was no crepitus. Next, we're going to look at your ears. The ears are symmetrical. The skin matches her face. There are no lesions, no masses, no erythema on the outside of her ears. I'm going to do the whisper test. What number did I say?
24. 44.
All right, cranial nerve 8 is intact. Patient was able to hear me whisper in her ear. I'm going to look on the inside of her ear now. All right, the right external canal does not have any lesions, erythema, any masses, no discharge. The tympanic membrane is a grayish pearly color with no erythema, no lesions, no masses, no bulging, no fluid. And the conal light was at 5. All right, the external canal in the left ear did not have any lesions, any discharge, any erythema, any masses. The tympanic membrane was a grayish white color. No erythema, no lesions, no masses, no fluid, no bulging, both within normal limits. I'm gonna get my gloves. The lips are pink and dry, no cracks, no fissures. I'm gonna have you open up so I can inspect the inside of your mouth. Gingiva is pink with no lesions, no masses, no erythema. Oral mucosa is pink, no masses, no erythema, no lesions. Dentation is intact. I'm gonna have you say ah. Hold your head back. Okay. Uvula rose to midline and is pink and moist. No erythema, no edema, no masses or lesions. The tonsils were not visualized bilaterally. The soft and hard palate are pink and moist. They rose to midline. No erythema, no masses, no lesions, and the pharynx, posterior pharynx was pink and moist. No erythema, no lesions, no exudates. All right, I'm gonna have you stick out your tongue. Okay. Tongue is pink and moist, no lesions, no erythema, no masses. Cranial nerve 12 is intact. The tongue was midline with no tremors or no deviation. I'm going to test the lymph nodes of the head. Okay. Supraclavicle, submental, submandibular. I'm trying to make it so they can see where I'm at. Tonsillar, periocular, postocular, occipital, and none of those lymph nodes were palpable. I'm gonna come from behind and I'm gonna test your, check your thyroid, okay?
Okay.
Alright, thyroid is not enlarged, it is smooth. I do not feel any nodules, and it's midline. Turn your head left, swallow. Turn your head right, swallow. Okay, trachea is midline. I'm going to now listen, well, palpate your carotid arteries, and then I'm gonna listen to make sure I don't hear any bruise. Carotid arteries are 2+ and symmetric bilaterally. And now with the bell of my stethoscope, I'm going to listen to her carotid arteries. No bruise noted bilaterally of the carotid arteries. Okay, now I'm going to have you close your eyes and tell me what you're feeling, if it's soft or is it sharp, okay? Dull or sharp, okay? No, close your eyes. Is it soft?
Dull, soft,
Or you can say dull or sharp, dull or sharp.
dull, 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 sharp, 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 sharp.
All right. Now you can open your eyes. I'm gonna have you puff your cheeks. Do a big smile. Show me your teeth, please. All right, lift your eyebrows up and down. Okay, cranial nerve 7 is intact, as well as the face having bilateral and equal sensation. Okay. Now I'm going to shrug your shoulders. All right, now do it with this resistance. Don't let me push them down. Okay, cranial nerve 11 is intact with 5 out of 5 strength, with and without resistance. I'm gonna have you turn your head left, right, back, forward, and side to side. Now, do it against my resistance. All right, forward, okay, back, all right, left, right, side to side. Okay. Head has full range of motion, 5 out of 5 strength, with and without resistance. I'm checking your arms now. Call your arms out for me, please. Okay. Epitrochlear lymph nodes are barely palpable and they're movable. Brachial pulse 2+. Radial pulse 2+. Fingernails are pink. Cap refill is less than 3 seconds. Now I'm having you hold your arm up, down, out, in, and back. Now we're going to do it against resistance. So up, all right, down, out, in, all right, and back. Back. Okay. Upper extremities have full range of motion. Strength is 5 out of 5, with and without resistance. All right, I'm gonna have you close your eyes. All right, I'm gonna have you hold this right here, and let me know if you can identify what item that is.
It's a depressor.
Okay. Stereonosis is intact. All right, while you're sitting there, I'm gonna close your eyes and have your arms out, palm upward. Okay, you can stop. No pronator drift is noted. All right, I am inspecting the chest. AP diameter is less than transverse. I'm listening to heart sounds. All right, so first we're going to start with the aortic, which is in the second intercostal space at the right sternum border. Pulmonic, second intercostal space at the left sternum border. Herbs, third intercostal space at the left sternum border. Okay, tricuspid, between the fourth and fifth intercostal space at the left sternum border. And the mitral and also the PMI, which is on the fifth intercostal space at the mid-clavicular line. S1, S2 sounds were heard. No murmurs, no clicks, and no rubs were heard, which is within normal limits. Now we're going to listen to breath sounds. Once I put this down on you, take a deep breath in and out. No adventitious breath sounds were heard. No rails, no wheezing, no runkies were heard in the bilateral anterior space. Okay, I'm gonna have you stand up. We're gonna listen to your breath sounds in the back. Turn around, your back. All right, don't sit down yet. Okay. No adventitious breath sounds were heard. No rails, no bronchi, no wheezing. Now I'm checking for tactile firmness. Okay, say 99.
99.
Again.
99.
Again.
99.
Okay. Firmness was equal on both bilaterally. Had it been increased firmness, I would suspect pneumonia. Decreased firmness, I would suspect a pneumothorax or a pleural effusion. And while I'm back here, I'm going to test CVA tenderness. All right, let me know if this hurts or uncomfortable.
No pain.
Okay.
No pain.
Okay. No CVA tenderness. All right, you turn and sit down. Now we're going to inspect the abdomen. So I'm going to have you sit all the way back and lay down flat. Move this a little closer. Okay, I'm inspecting the abdomen. Let me lay this down just a little. All right, there are no lesions, no masses, no scars, no striations. I'm now going to listen to her bowel sounds. In office, you would have to at least listen to each quadrant for 5 minutes at least, but due to time constraint, we're just gonna listen for a little bit. And I'm starting with the right lower quadrant. Normal bowel sounds are heard in all 4 quadrants. Now I'm going to go listen to the aortic vein above the umbilicus, more up in the upper gastric area. No pulsations or bruits heard. The renal arteries, which are to the upper left and right of the umbilicus. No pulsations or bruits heard there. And the iliac veins. And those are to the bottom left and right of the umbilicus. No bruits or pulsations heard there either. Now I'm going to percuss. Any pain or anything?
No pain.
Okay. Tympanic sounds through all 4 quadrants. Now I'm going to do light and deep palpation. Let me know if there's any pain.
No pain.
Okay. So I did light and deep palpation, no pain with that within those testings. And now I'm going to do left area abdomen palpation a little deeper to see if there's suspicion for appendicitis. Any pain?
No.
Alright, once I pressed on her left side of the abdomen, she did not feel any pain on the right side. Had she felt pain, I would have suspected appendicitis. Okay, those are your hips. Alright, the hips are symmetrical. Now I'm doing the arbitrator sign. So I'm going to lift in your leg, 90-degree angle, inward, outward. Did you feel any pain anywhere?
No.
Okay, has she had any lower abdominal pain? That would be another sign to suspect appendicitis. I'm going to have you turn on your left side. Doing the psoas sign. All right, bend the knee, please. Now move it back for you. Let me move it. Any pain?
No.
All right, has she said she had pain in her lower abdomen anywhere? That's another reason to suspect appendicitis. Okay, you can lay down because now I'm gonna test your legs, your extremities. All right. So let me move this back so they can see. Okay. Popliteal post 2+, posterior tibial 2+. Dorsal pedis 2+ pulses. All right, so lift your leg up, down, out, in. All right, same with the other one. Up, down, out, in. Now we're gonna do it against resistance. So up, very good. Down, all right, out, all right, in. Okay, up, okay. Down, okay, out, all right, in. Okay, we're gonna do the same thing with the ankles. Point down, up, in, out. Other ankle, up, down, in, out. All right, now against both at the same time. Up, down, in, and out. Okay, lower extremities as well as ankle, have full range of motion, movement, 5 out of 5 strength, with and without resistance. And while I'm right here, I'm gonna do the Bamsky test. All right, positive, because her toes did move once I did that. I'm gonna have you sit up. All right, so I'm gonna have you use your hands like this. All right, now take your right foot and rub it up against your shin. All right, take your left foot and rub it up against your shin. All right, coordination is intact. All right, now I'm gonna have you stand up with your eyes closed. Let me move back some. Okay, Rumberg test is negative. Usually you have a person stand up, have their eyes open for 30 seconds, and then close them for 30 seconds, and make sure they don't fall or stumble or anything while they're doing this. Now I'm testing her gait. All right. So watch me. Foot to toe, toe to foot, toe to foot, toe to foot, and come back. All right. All right, you can turn around and come back. All right, you can have a seat. All right, her gait is intact. All right, I'm now washing my hands. And now this concludes my head to toe assessment.